This is a procedure that was done initially by the surgeons, which was open sacroiliac joint fusion, which is requires hospitalization, sometimes blood loss, and require blood transfusion. It's a painful procedures and requires pain management in the hospital. That particular scenario is totally changed now. 80% of procedures are done as a minimally invasive procedure. So what to expect is some soreness for week to 2 weeks at the site of surgery, but not strong enough to really that patient cannot do any regular work. They might feel soreness, so sitting for a long time might be a problem. And sometimes we tell the patient that the side of the surgery might interfere on the side of the lower extremity, and we tell them, if you want to drive, be very very careful. It may affect your driving ability because of the constant soreness. But it is the soreness, it's not the severe sharp pain I expect that requires patient to lie down or do some kind of focus rehab. So it's a minor soreness. I do not expect any infection because it's very minimally invasive procedure in a clean area. So you don't require any antibiotics other than the prophylactic antibiotic before the surgery. That's basically it. Incision is very small. You can use absorbable sutures, so patient doesn't even have to come to remove the sutures. There might be some bleeding at the site of small incision. That bleeding is actually coming from the bone marrow, because we are working in the very strong area where there is a very strong bone marrow, and bone marrow might come out from the incision site, feel like it's a blood, but it is not a bleeding that you need to worry about that, and that stops roughly within 24 hours. So maybe you require a dressing change, but other than that you don't really need to do anything.